Let's bring in ABC's medical contributor, Dr. John Brownstein. He's Chief Innovation Officer at Boston's Children's Hospital. So, John, hospitals in at least 26 states, as Ariel has been talking about, plus Washington, D.C., seeing this major uptick in RSV in kids. What about you? Are you seeing this in your patients as well?
Yeah, so Kira, good afternoon. We are seeing this rise in reported RSV cases in our hospital and across the region. And this is unusual. You know, we wouldn't see this level until midwinter, and we're seeing kids getting sicker and needing to be admitted to the hospital, and hospitals around the region are getting overwhelmed. And what we're seeing is capacity at its highest in the last 2 years, even beyond what we dealt with Omicron. And we also, on top of that, have a staffing shortage across this country, burnout from COVID. And not only RSV, but we have other respiratory viruses like rhinovirus, flu, and enterovirus. So it's a bad time in pediatric hospitals around the country right now.
So how is this different from things like COVID and the common cold? What are you actually telling parents, you know, who understandably want to know what's going on with their kids?
Right. Well, RSV is very common. It's actually one of the most common causes of mild and cold-like symptoms. And most people recover in a week or two, you know, but it can be serious. And it's the most common cause of pneumonia in kids under 1. You know, we get 2.1 million outpatient visits a year for RSVP, over 50,000 hospitalizations from RSV every year. So it's a significant burden. So it's not unusual, but we're to parents, of course, we want them to monitor symptoms, make sure that if any symptoms sort of progress into that sort of labor, breathing, wheezing, body aches, that they should call their primary care physician or pediatrician, because of course we want to make sure that things don't get worse. But of course, for most kids, they'll recover just fine from infection.
All right, because for full disclosure, my daughter has something going on right now, and it's moved over to my husband, and it's not fun, and it's not COVID because we're testing for COVID every day. And there's some other doctors suggesting that this rise in respiratory illnesses is in part because of relaxed COVID restrictions. What do you think of that?
Well, yeah, I think it's definitely part of the fact that now we're finally mixing again. We're removing masks. We're not doing social distancing. And there's a reduction in immunity in the population. We are used to these respiratory viruses cycling every year. But with COVID, we sort of, you know, held back because there wasn't that level of transmission. So those respiratory viruses weren't cycling in the same way. And now we're back together. And so these viruses are coming back with a vengeance. And so we sort of have this unfortunate perfect storm because you have these seasonal viruses. We may have a bad flu season. We also may have a COVID variant in the rise. We'll see. So it's a tough challenge right now. And that's something that, you know, our team is trying to forecast to see how bad these next few months are going to look like.
Well, I'm sure glad we have you to talk to, especially as a mom. I appreciate these interviews. Thanks, John.
Thank you, Kira.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.